Hey everybody, it's Dr. Greg with Judice Sports and Rehab. We are going to be answering 2 questions today about the wrist. So today is the first Friday of September, so we're in a new month, we're in a new body region, so we're going to be talking about the wrist. So figured we'd just finish out the upper extremity this month since we already talked about the elbow and the shoulder over the last couple. So let's get right into it. The first question is from Mary. Mary is someone who has had wrist pain before, and after treating her shoulder, her wrist pain went away. And so why that is basically she was using her wrist too much, not using her shoulder and shoulder blade enough, and was having some issues with the wrist for daily activities. So that overuse caused some pain through the wrist. Once she treated the shoulder, the wrist pain went away. So that's not part of the question though. The part of the question that she asked is, the pain is starting to come back. Should I use a mouse or a touchpad? Because it seems to make a difference. So this is a good question. This is an ergonomic kind of question, and I enjoy some of those more tedious specific questions. So we're going to use a business card holder as a fake mouse. So basically, if we're using a touchpad, we're typically having to move the wrist back and forth to reach the part of the page that we're doing. So that side-to-side movement of the wrist, because the elbow and arm are typically rested while you're doing that. However, when you use a mouse, a lot of times that motion is coming from the elbow and shoulder and is less wrist motion. So she may actually succeed more with having the mouse rather than the trackpad, just because she's able to move the arm as a unit and take the stress away from the wrist in that scenario. So that's a great question, and we do quite a bit of ergonomics assessments, whether it's here in my office or take pictures of you in your office. So if that's something you guys are interested in, please let me know. You can just comment below if you're interested in an ergonomic assessment. And then the second question that I got was, do I really need PT after a sprain, a wrist sprain, or after I have been casted? So whether that's a sprain or a fracture, do I need PT afterwards? And the answer is definitely yes. So when you get that cast off or that brace off, you're going to be very stiff through the wrist. And so as a manual therapist, we really want to regain that mobility within the joints of the wrist. So making sure that we have full range of motion into all the directions of the wrist. So that flexion, extension, and those side-to-side motions as well. So that is most definitely a yes. You would definitely need PT after being braced or casted after a sprain or fracture. So great questions this week. I think we're going to have another Q&A on the wrist in a couple of weeks, and next week we'll do something different. So we'll see. We're still trying to figure out what you guys want for the for these live videos. So if you have any suggestions, please post those below as well. I think we're going to try to stick with the joint of the month, but if you have suggestions for specific things you would want as part of the joint of the month videos, we would love to hear some feedback on that. I think that pretty much closes us out for today. Again, this is Dr. Greg with Judice Sports and Rehab. Thank you guys so much, and we'll see you again next Friday.